I will start with the corporatization of medicine right now. You have a bill to basically fight this. Can you share a few details about the Patients Over Profits Act?
You bet. And the name kind of sums up what the goal of our healthcare system should be. It should be about delivering good health care to patients, not profits, certainly not profits to these mega insurance companies that are buying up practices, clinics all over America and pharmacies, grabbing control of all elements of it. In fact, that the one group, the group that bought out the Oregon Medical Group in Eugene in 2000 and then the Corvallis clinic last year, that one group now employs like 90,000 doctors, 10% of the workforce at the clinics across America. Gives them enormous leverage to use their lawyers, to use their lobbyists, use their campaign donations, all to basically create laws that favor the squeezing of Americans uh, to produce less health care and more money. It's corporate greed. So I really appreciated former Governor Kitzhaber bringing this to my attention, and we've been working very closely with others, including Elizabeth Warren of Massachusetts, Ed Markey of Massachusetts, and on the House side with Val Hoyle from our own Congressional District Number 4, who is leading the effort in the House of Representatives, to say, look, no, we're just going to ban insurance companies from owning these clinics. And in addition, in a belt and suspenders fashion, we're going to say that, hey, the Health and Human Services Department cannot contract with an insurance company to deliver, like, for example, Medicaid Advantage if they own a clinic. So it's two different ways going about the same outcome to say, get out of this business. The insurance company makes money by dumping healthy people, dumping sick people out of the insurance plan and dumping sick people out of the clinics. And we saw when Optum bought the Oregon Medical Group, they kicked thousands of people out of their list of patients that they serve. And that is all about profits, not about patient care. We've got to try to stop this corporate takeover that's not serving us well.
Well, I want to address the biggest news for us for the last days, the Charlie Kirk assassination and political violence. What was your or what is your reaction?
I just felt sick. We've had political violence from the right, from attacks on Black congregations to the attack on the Minnesota state legislators. We've had political violence from the left. And the leadership of the country at every level needs to say our shared principle is that we decide things through debate. We decide things through elections. We decide things by lobbying our legislators on specific bills or our governments on how they implement those bills. That political violence is 1,000% unacceptable. And it's not okay for leaders to blame one side or the other. There's violence coming from both extremes, and we have to say both are wrong, both are unacceptable, and do everything we can uh, to to send that message broadly and thoroughly.
There is what I see and sense a lot of turmoil in society right now, a lot of angst after this happened. Uh, What do we do next? What's the next step to move forward as far as where society stands?
Well, it has to be a national conversation. I'm very disappointed in President Trump, who tried to turn it into more political hostility between the left and the right, rather than calling it out like it is. It's wrong no matter where it originates, and it's originating on both sides. The It just and tell you, a lot of members of Congress are thinking about whether they even hold public events anymore. That is not a government that serves America well. We have one of the most, and I think really the most accessible democracy in the world. If you go to many European capitals, there's no way you can walk into the building and go and knock on the door of a member of parliament or a member of the Bundestag or other governmental groups. It's like, no, the whole compound's off limits. But that's not America. We've had people are swarming the halls of Congress right now, and that's great. We have some more security than we used to at the doors, yes. We sometimes have to put up in big rallies. We have to put up fences following the assault on Congress. Uh, but we're still incredibly open, and we want members to go home and hold open meetings, open conversations, public town halls. I hold 36 of them in Oregon. I want to keep holding them. And but we need people at every level, our leadership, not just our political leadership, but our religious leadership, our community leadership, leadership of any kind to say, no, violence is unacceptable. Go vote, go organize, go protest, but no violence.
Um, Cash Patel, he is taking a lot of heat for how he managed the Charlie Kirk investigation. What is your response to his management of the case?
Well, it's very unusual for the head of the FBI to get out there and start doing public proclamations right in the beginning. And not only did he do this, but he got it wrong. And it's just a sense that he's an amateur in a role that requires a professional. But he is the president's selection. He's been confirmed. He's in the office. I just hope he can improve his performance. And one of the things that is really disturbing, apart from his lack of bringing appropriate experience to bear, is the sense that he is participating in the Justice Department's politicization of the work they do. It's been such a proud sense of the FBI that they are above politics. They are professionals. They do not launch research and investigations because the president says, I want you to investigate my political enemies. There's a sense that the entire Trump administration is um, turning different departments, including mortgage world, into an instrument to settle political debts rather than to serve Americans. And that's just wrong.
I'm going to shift gears just a little bit. One of our viewers reached out this morning and asked, what are your ideas or what ideas are brewing to combat the unhoused and addiction issue that continues to plague the state?
I first met my wife, Mary, when she was working at a shelter. And so during the time we were dating, I spent a lot of time there and I got very acquainted with a lot of the women. And the, the women who were there for a short time, generally it was economics that was driving their homelessness. Women who were there for a longer period of time, it tended to be either addiction or mental illness. This particular organization set up a pre-treatment program for addiction and a post-treatment, because if you are back on the street following an addiction program, people want to just hand you drugs and then you're right back in the same mess all over again. And then they also had a mental health program, and by getting people off the street, it was much more likely that individuals could stay on their regimen of medical assistance to help them function at a much better level. So you have to understand the root causes, and you have to have programs to address those root causes. And then in addition, you have to have enough housing, and we don't have enough housing. So we can incentivize, if you will, home ownership, which I love because it's been a major wealth builder for middle class America. And we need to get the hedge funds out and force them to sell their homes to families. But um, if every house is occupied, then it's going to be very expensive to buy and it's going to be very expensive to rent. So we have to be able to build more starter homes, more affordable apartments throughout the entire range. There are incentives for a developer who has land to build at the high end of the market, and great, that might be great for Californians moving up here from the high cost Bay Area or something, but it doesn't help address our homeless challenge. We also need a shelter system that has many steps in it. because essentially people need to be able to be off the street, but then hopefully they can graduate from a group shelter to some sort of smaller accommodation, or maybe an SRO, single room occupancy. I lived in an SRO where I had a bathroom down the hall. It enabled me to live on a very low income in New York City when I was a fellow for International Affairs Group, the Carnegie Endowment for International Peace. I earned $800 a month, and I lived quite well because I only had to pay $50 a week for my room, and that included 3 dinners. So that was a sweet arrangement. So affordable options throughout the entire spectrum. We've got to build a lot more of that and incentivize a lot more of that.
And I have one more question for you, Senator Merkley. I know we've talked in the past about wildfire mitigation, but I want to bring it local.
But there is a partnership that happens on services, including fighting wildfires. And my goal has been to increase the federal support for the federal end of those partnerships. And one of the things that just happened was I pressed strongly for change in the rules so that the companies provided masks to their firefighters, because we were seeing more and more firefighters having diseases stemming from the inhalation of smoke. And I was just appalled to learn the Forest Service had banned the firefighters from wearing masks to protect themselves against that smoke. I'm like, oh, you have to be kidding me. If you've been out on a fire line and anywhere close to it, there's a lot of smoke coming your way. That's horrendous. We also developed a lot more funding and raised the pay of firefighters so that there would be more people signing up. And they were trying to get a strategy where those who want to, when the fire season is over, well, the season's getting longer and longer, but when it's over, that they can switch to doing forest management so that they have year-long employment if they want it. There are firefighters tell me there are a lot of them that really like the idea of working the fire season and taking several months off. So that's fine too. But others are like, no, I can't stay in this business. I've got rent to pay every month. I've got a family. I can't stay in this business if I can't work when fire season ends. And so those are all efforts to try to back up our firefighting team, including repeatedly passing legislation to fund the training of Oregon National Guard members and actually National Guard members across the country to help form fire teams to back up the professional crews.